On, Dr. Dan, how are you?
I'm doing well. Mr. Pritchard, how you doing?
I'm doing great, man. Listen, I appreciate you setting a little bit of time aside to talk to us. Found that a lot of clients, I don't know how you feel, but found that a lot of clients are wondering, hey, what's going on with my treatment? What do I need to be doing? Can I treat? All these kind of interesting maybe scenarios we've never seen, of course, in what you and I do in the realms of personal injury. So I appreciate you making the time. Just wanted to ask kind of from your perspective a couple of things. If you'll just, number one, introduce yourself, tell us who you are, and then and I'll ask you kind of some other things that my clients have been asking me.
Okay. Yeah, my name is Dr. Daniel Turner. I'm a chiropractor, practice out of Canton, Georgia, kind of South Canton area if you're familiar. Practice primarily with personal injury patients and sports patients. So
Very cool. Yeah, man, I appreciate that. It's cool that you do the sports component too. I mean, I really dig that. That's awesome as an athlete myself.
yeah, had worked with a
Kind of,
couple professional sports teams back in California and Olympic athletes. And
what kind of things are you guys doing? I mean, you're in your own office to kind of make sure that you're complying with all of these crazy, executive orders that are coming out kind of every day. What are you guys doing to be safe?
I mean, we're trying to go above and beyond, just to be very cautious about what we're doing. We take all kinds of precautions. Obviously, we have masks, so everyone in the office has a mask on. We are constantly, some people don't like it, but we're constantly disinfecting everything. Lysol on door handles. Pretty much every surface that is touched, we are constantly wiping down and spraying. We have hand sanitizer located basically at every area that one of our patients is going to touch. Be it the check-in screen, when they come back in the office. Anytime they're touching a surface, there's hand sanitizer around there. After they've been on a surface, we are disinfecting and cleaning everything. We're screening people before they come in, just asking basic health questions. Just make sure that nobody is showing any kind of signs or symptoms that they're sick.
Certainly the clients appreciate that. And so it sounds kind of like one of the other questions that I really wanted to know, and I kind of know this, but I want everyone else to know this too, because I get this a lot, is you guys are still open for business. So if you get in an auto accident now, kind of during the shutdown, you're still available to really provide those services. Is that what I'm understanding?
We're open. We're taking care of people. A lot of people are very confused because they don't know who's essential and who's not.
Mm-hmm.
They don't know who's open. So we're doing our best to just try to post every day to social media and just let everyone know, we're still open for you here. That it is important, for you to continue with your care so that, on our end of things, you're continuing with your care so that you're progressing and getting better. And, you're not either staying stagnant with your treatment and your symptoms are getting worse or whatnot, that they're improving, and that they're, not doing something, detrimental to the case or something on your end, because they're worried about coming in, and they're confused. And so they stop treatment, because of that. So we're trying to educate everyone, make sure that everyone knows that we're still open and it's important for the treatment to continue. One thing I didn't touch on is, we still are, able to refer out to other providers also, for the case. So we work with other medical providers, imaging facilities and whatnot. So, we have a list, we have a core group of people that are still open, that are still functioning, either they're staying open and providing procedures, or, they're teleconferencing and doing some telemedicine kind of thing, just to make sure that everyone is provided for and really getting the best treatment that they possibly can throughout this crazy shutdown.
Fantastic. So if you determined that it was something that needed a different discipline, you're still able to work with kind of like-minded people like yourselves that are still staying safe, able to provide those services one way or the other, so that the people can progress.
Absolutely. The client, the patient is first. We're here trying to get people, on our end, it's all about getting people just getting people better as best as possible.
Anything else, any other words of wisdom or anything else that you can share with us that you think is important to know?
No, just, be informed. If you have questions, call your attorney, call your medical providers. You really shouldn't be out on your own to solve this whole thing and to, try to make sense of it. There's a lot of people doing good work that are taking precautions and that are looking out for you. Just ask around and get good advice. Watch these videos and listen to what people are saying.
Yeah, I would absolutely agree. I think it's important that everybody, the attorney, the provider, everybody's kind of on the same page and on the same team. I agree. So thank you for that as well.
You're welcome. And it's you know, we see humanity changing a little bit during these times, and
Yeah.
it looks like, it's sad that it had to come to this point, but it looks like people are really looking out for each other during these
Right.
times,
Yep.
and it's a great thing to see. And people are a lot more open to helping other people out. So let someone help you out. Don't be stubborn, and let good people do good work.
Absolutely, man. That's all great advice. Well, listen, thanks again. It's always good to talk to you. And like I said, hopefully be in touch. Stay safe out there and see you soon.
Absolutely. Take care, Zach.